I've been getting questions pretty much daily now about how do I dose the GI Janel 1 powder, which is the powder that is meant to treat fermentation symptoms, gas, bloating, and all the associated pain that goes with that. A lot of these people have been diagnosed with SIBO or IBS, so that's what it's for. Anyways, how do you dose it? Well, I was inspired by this question that I got from someone who I believe is in the United Kingdom. And they reached out and let me know that they're doing this sulfur protocol on their own. They've been suffering really badly for 4 years and their life was really difficult. They found the protocol and started doing it and now have questions about dosing. But where they're at so far, um, 4 weeks in, and they're seeing massive progress, especially compared to anything else that they've tried. So thank you so much for letting me know that. That's actually really important to me, to know that people are getting better, to know that people are finding this option rather than the options that seem to be handed out quite liberally currently, which are a lot of antibiotics. And, I mean, antibiotics, digestive system, good idea? I don't think so. I think chances are with this use of antibiotics for a SIBO diagnosis that's pretty prolific, at least in my neck of the woods, chances are we're long term we're doing more damage than good. So I'm glad that you reached out. Thank you. Let's cover some dosing. So first of all, we'll start with the beginning. So when you first start to use the GI Janel 1 powder, the sulfur powder, you're going to start to titrate up to the full treatment dose. That's important. And especially if you're like this person who's been suffering for 4 years. They've been through a lot, their systems are sensitive, and you want to gradually increase your dose for two reasons. One is you're killing yeast, you're killing bacteria, and that can cause a die-off reaction, meaning that your body has to go in there and your immune system has to go in and clean up all the mess from what you're getting rid of. So that can make you feel kind of flu-like or tired or achy, what have you. But that's a good sign that you're actually, doing the work. You're getting the task done in there. And then the other thing is some people have a sensitivity to sulfur, not an intolerance. We can't be intolerant to something that's the fourth most common mineral in our body. We have twice as much sulfur in our body as we have magnesium. You can't be allergic, you can't be intolerant to sulfur because that would not be compatible with life. So everyone can do this. It's just that in the beginning, you might have to make some adjustments to get your body acclimated to that nutrient information that you're giving it. They will eventually catch up and your body will be able to converse with the information that you're giving it and handle it really well. So not to worry. If you're really sensitive, start with a very small dose. Smallest dose would be a little pinch in water every day. An eighth of a teaspoon, a quarter of a teaspoon, a half a teaspoon. If you're not a sensitive person, you can start there with a half a teaspoon. And then you want to increase your dose in increments every 3 to 7 days. So let's say you start at a quarter of a teaspoon and you do that for 3 to 7 days. You're like, okay, I'm ready to go up. So you go up in your dose to a half a teaspoon now, and you notice, oh yeah, I feel kind of tired, or I feel, a little more achy, or maybe I get a headache. Those are all very normal reactions. Like I just explained, they're die-off reactions, or you're getting your body acclimated to this nutrient. So what you do is you hold your dose there until that goes away. So you go from a quarter to a half a teaspoon. You notice some symptoms. You hold that half a teaspoon dose for 3 to 7 days until that abates and that's gone. So you take your daily dose, you're no longer having any kind of side effects, die-off reactions, and then you can increase your dose again. So maybe you'll go up to a full teaspoon, or maybe you'll go up to 3/4 of a teaspoon, depending on your sensitivity level. You. This is not a race. You'll get there. You might have to go slowly at first, but in the long run, it will be worth it. I mean, just listen to what this person is saying. They have massive progress in their digestive symptoms after using this very simple treatment, basically a nutrient replacement treatment for deficiency in the body. So you're going to gradually do those incremental doses. Once you get up to sort of like a mid-range dose, about 15 grams, which is 3 teaspoons, most of those symptoms are going to go away. So, side effects are going to go away, and you'll be able to increase more rapidly to the full treatment dose, which is 30 grams, which is the equivalent of 6 heaping teaspoons, which is the equivalent of 2 tablespoons, 3 teaspoons to a tablespoon. You're going to hold that for 8 weeks. So every day you're going to take that dose. Now, how do you do that? Any way you want to. I find that it does work best between meals, but you could take it with meals if you want to. You could take it all at once in one dose. You can divide it up into 6 doses during the day and do 1 teaspoon at a time, or even more than that. The goal is to get your daily dose in that 24-hour period. And that's really all you need to do. You can mix it with orange juice, disguises the flavor pretty well. Water. I had someone that mixed it once with chocolate syrup and it still worked. That's because the deficiency you're replacing and the effects, the anti-inflammatory effects, antifungal, antimicrobial, structural effects of the sulfur are going to override those food problems you picked up along the way, which is also great because then you can expand your diet back out into a more whole food, nutrient-rich diet if you want to in the end, after your system and symptoms are gone. So that's it. You're going to do that, and then you can do a maintenance dose if you want to. I personally take it every day, of course, but that's up to you. I mean, it's essentially an anti-inflammatory, antifungal, structural for your body, and I believe that there is, if you listen to some of my other information, there's a deficiency of sulfur out there based on some of the practices we have. Okay, my cat needs me. I have to go. Please feel free to leave me messages, and I'll make more videos and address those for you.